Exosome treatment for rheumatoid arthritis. Rheumatoid arthritis, RA. Exosome treatment is a new therapeutic strategy that makes use of exosomes' immunomodulatory and regenerative qualities. Small extracellular vesicles, called exosomes, can transport bioactive substances across cells, changing immunological responses and cellular behavior. Exosome treatment can alter the underlying disease processes in addition to relieving symptoms, which might have a longer-lasting and more significant effect on the advancement of RA. For the treatment of rheumatoid arthritis, exosome treatment entails separating the exosomes from donor cells, usually mesenchymal stem cells, MSCs, purifying them, and then injecting them intra-articularly or systemically. By transporting bioactive chemicals to injured joints, exosomes enhance joint function, stimulate tissue healing, lower inflammation, and modify immunological responses.